We will now begin part 2 of chapter 11. So we're going to start with cigarette smoking. Cigarette smokers not only tend to die at an earlier age than non-smokers, but also have a higher probability of developing certain diseases, including cardiovascular disease, including cancer, bronchopulmonary diseases, and other illnesses. Cardiovascular disease. Smoking causes coronary heart disease, the leading cause of death in the U.S. Compared with non-smokers, smoking increases the risk of coronary heart disease 2 to 4 times. Smoking puts smokers at a greater risk for developing peripheral artery disease, and women who smoke have twice the risk of developing coronary heart disease. Cancer. Cigarette smoking is a major cause of cancers of the lung, bladder, pancreas, cervix, esophagus, stomach, oral cavity, and kidneys. The risk of cancer increases according to the number of cigarettes smoked each day, the number of years a person has smoked, and the age at which smoking began. The risk of lung cancer in men who smoke 2 or more packs per day is 23 times greater than the risk for non-smokers, while the risk for women is approximately 13 times greater. Even if you smoked, let's say, in your early teens and then stopped smoking early 40s, you still could have risk factors in time because of the teratogenic effects that smoking does have to your body. Bronchopulmonary disease. Cigarettes damage the airways and the alveoli and cause emphysema, chronic airway obstruction, and emphysema. If you look at this diagram or this picture here, it shows normal alveoli and then alveoli with chronic obstructive pulmonary disease. So you can see how there's inflammation, and what happens with the tar from smoking, your lungs lose some of the elasticity. So go grab a straw and try breathing only through that straw. Do not breathe through your nose, but only breathe through a straw. That's what it feels like for individuals who have emphysema or any kind of ailments associated with their lungs where they can't breathe. That's what they feel. Other effects, so there's birth effects that are associated. For example, you have an increased risk for having a stillbirth, preterm delivery, even infertility. Babies are born at a lower birth weight, and it has been implicated in sudden infant death syndrome. It does reduce the amount of blood in the fetal cardiovascular system and can cause constrictions in the blood vessels of the umbilical cord and uterus. Another effect that sometimes happens is placenta abruption or previa. So placenta abruption is when the placenta detaches from the uterine wall, which could be extremely dangerous to that baby because now it's not getting the nutrients from the mother that it needs, so you will need to have an immediate delivery. And placenta previa is where the placenta attaches itself low, close to the cervix, or even sometimes blocking the cervix, so that, for one thing, that's not the best placement for the placenta, but it will also block the exit for the baby out of the birth canal. Light cigarettes. So there is no conclusive evidence of reduced health risks that are associated with low tar cigarettes. Filtered cigarettes reduce the levels of tar, nicotine, and carbon monoxide at the mouth end of the filter, and there should be some kind of limited benefit. Many smokers lose this benefit because they often will smoke more cigarettes per day, increase the number of puffs or volume that they take, and or block the filter holes with their fingers or their lips. E-cigarettes. This is a biggie. You've probably been seeing a lot of this in the news lately because now e-cigarettes are having to follow the same rules as normal cigarettes in terms of if smoking is banned in a certain area, for example, indoors, so is e-cigarettes. We are probably in the next 10 years are going to start seeing more data on the effects of e-cigarettes, but we do know that metals are released into the air. So who knows? Maybe our offspring who are going to be exposed to e-cigarettes will be born with antennas because of the metals. I don't know. Just kind of kidding there. But we will start to see some of those health effects that are associated with e-cigarettes. It's currently being evaluated, and again, there isn't any concrete scientific data to back up all the claims of the issues that are associated with it, but they are coming, believe me. Tobacco use without smoking. So there are other methods of tobacco use. One is chewing tobacco or snuff. Sometimes someone will take a little packet called snus and put it inside their mouth. It looks like a tea packet, and they put it in between their lip and their cheek and or their gums, and that's how the tobacco is introduced into your body. This can lead to nicotine addiction and dependence. Adolescents who use smokeless tobacco are more likely to become cigarette smokers. It contains 28 cancer-causing agents. And smoking tobacco is strongly associated with something called leukoplegia, and that is what that picture is. That is a tongue with leukoplegia. Smokeless tobacco increases the risk of developing cancer of the oral cavity and the pancreas. Smokeless tobacco use during pregnancy increases the risk for preeclampsia, which is a very dangerous thing to happen during pregnancy. It's basically high blood pressure of the mother that could lead to death in both the baby and the mother. Premature birth, and having a low birth weight baby. Smokeless tobacco use by men causes reduced sperm count and abnormal sperm cells. Smokeless tobacco is associated with recession of the gums, gum disease, and tooth decay. You want your mouth to look like this? Ugh. Secondhand smoke includes a mixture of smoke that comes directly from the lighted tip of a cigarette, cigar, or pipe tip. Passive smoking is referring to the non-smoker's inhalation of the tobacco smoke. Secondhand smoke exposure causes an estimated 46,000 heart disease deaths annually in the U.S. So, benefits of cessation. A return to normalcy of heart rate and blood pressure, which are abnormally high while smoking. A decline in carbon monoxide in the blood within hours. Improved circulation, the production of less phlegm, and decreased rate of coughing and sneezing within weeks. Substantial improvements in lung function within several months. You have a decreased risk for lung and other types of cancers. Decreased risk for coronary heart disease, stroke, and peripheral vascular disease. And a decreased respiratory symptoms such as coughing, wheezing, and shortness of breath. You have a decreased risk of developing chronic obstructive pulmonary disease, decreased risk of infertility in women, and a decreased risk of having a low birth weight baby. So methods of quitting. There are methods to slowly wean you off of your nicotine addiction, and this includes gum, patches, spray, lozenges. There are medications that can help. The best way is to enroll in a smoking cessation program that has multiple sessions. Over the last 15 years, I've been involved in evaluating a huge tobacco project within the county of Orange. And Orange County offers free cessation through Anaheim Memorial Medical Center. If you're interested in finding out information about their programs, you can contact Anaheim Memorial and ask for their smoking cessation program. It is something that is offered free of charge to everyone who works or lives in the county of Orange. Los Angeles County is associated with 1-800-NO-BUTS. They do provide cessation materials, but not the same level of cessation methods as Orange County. So if you can get into Orange County, it is a great program, and it has huge success rates. I want to say the last time I looked into it, their success rates were like 26%, which is huge. Nicotine is very addictive, and it's difficult for people to quit. But having the right methods and modalities to help you will make the difference.